I knew I wanted to start there. Sorry, got a little pop-up. I knew I wanted to start there because I am a second generation South Asian woman, and I know it is a group of individuals that are very much not researched. There's very low, like rates on statistics on mental health for South Asian women, and in general, just not that many studies that have been conducted in the US on South Asian women. So I felt like this was just a very important research area that needed more, information on. And I think, so to be more specific, also second generation individuals refer to those who are born in the US to at least one immigrant parent, or children born abroad who came here before the age of 12. And that children who came here before the age of 12 is sometimes called the 1.5 generation, but for the purpose of the study, they're included as second generation because they spent most of their adolescence here and most of their education was in the US. So I feel like their experiences are just, as valid as those who were born in the US. But the most important part of second generation women is that they face challenges related to exploring their South Asian culture and their American culture. So it's very hard to integrate both of those cultures in their everyday life, especially because they're varying between their parental homes and their lives outside of the home. So I felt like that was just like a very niche area that needed more investigation on, like the overall question is, why are South Asian women struggling to seek professional help? And I think some of those factors come from this piece of being in the second generation and experiencing cultural conflict. So that comes to like the second part of the study, which is cultural conflict. And that basically just means, it's defined as like negative affect and cognitive dissonance when you're trying to assimilate values and expectations of the majority culture into your own culture. So for that, like a lot of people struggle with, similar to acculturation, like integrating both cultures together. And there are specific parts of that that have conflicting values with like the American culture and the South Asian culture. So the two things that I thought were really important to look at were collectivism and gender roles. So to go a little deeper into collectivism and gender roles is that typically in South Asian families, individuals are viewed as a representative of the family, and there's like a lot of pressure to maintain harmony and minimize any actions that could jeopardize the family and community. And I know that plays a big role for women trying to, report their sexual abuse or assault, or even disclose it to any family members or friends. That like ruining the family's reputation and dishonoring the family is like a big theme that I saw across the research, and to why they didn't want to disclose their experience, or they didn't want to disclose their abuse. So I think a big part of that is like living in the collectivistic manner and like trying to identify what their relationship is outside of the family, or what their identity is outside of the family. So I think a lot of research articles highlighted that like sexual abuse and just in general, like dating, sexuality, dating preferences and things like that are just not talked in as easily in South Asian communities. So even talking about like sex in general is just very taboo. So I think that already plays like another role into why women find it harder to disclose their abuse. The second thing is gender roles, which I think typically in South Asian culture, and I also want to preface that like there's so many different cultures, even in the South Asian culture, like so many different nuances, so many different countries that are part of South Asia. So this is just more of like the large ideology, like large themes that came out of it. And I know there are way more nuances in it. But another thing is gender roles, which I feel like South Asian women are socialized in a predominantly patriarchal society that conflicts with the Western ideals of autonomy and equality. So if you look at like, and even in that, like in America, if you look at most feminist movements, they're all based on white women, and South Asian women and just women of color in general don't have that voice as much in this country. So due to that, and due to like the greater flexibility in gender roles in America, I think South Asian women feel like they have less power and less, status once they move here and once they're integrated into this country. So that I think can create more of that cultural conflict. I feel like I'm talking a lot. Any questions about that?
No, you're doing good. You're doing good. Maybe like you can tell us about how you got interested in this.
Yeah,
And that's a good start.
for sure. I think the first, I think the first thing is that I wanted to research on South Asian women in general, just because I identify as that. I knew there was less research out there about that. And I think the other thing that kind of sparked my interest on sexual assault and abuse was the Me Too movement that occurred. Like, I know it's been happening for a while, but it really, a burst of it came out in 2017. And I think that movement actually really inspired me to be like, okay, there's so many women out here that are experiencing this and feel like they don't have a voice, or feel like it was, one, really, really hard for them to disclose that abuse and assault experience, and two, to feel like they were, like, who do they go to, right? Like, a lot of it was like they felt like they had the community support when they were kind of like doing the hashtag and kind of seeing that other women were experiencing the same thing. But I felt like there was also a lack of, like, where do we go from here? Like, where are the mental health resources we can go to? What is out there to help us? And I think specifically for women of color, like, a lot of the time they feel like they are understood in therapy because therapists don't understand the cultural nuances at times, or they don't understand like what there's different experiences that come with being a part of different cultures. And I think that was like another theme that I saw, like, researching, is that a lot of South Asian women felt like they weren't understood in therapy. And so I think that could also be a barrier of why they don't, seek out professional help. But I think that those, like, factors together, I think I was like, okay, this is something that I really want to study, because I feel like there's not really out there to see, like, how do we help this group of people?
So in terms of your research, I know you research about like South Asian women and sexual abuse. Have you like discussed, how do you talk to a sexual abuse survivor, and how does that work? How do you bring about this topic, and how do you just like figure out how to talk to someone about this sensitive thing? Because a lot of us are like pre-med, or we're current medical students, so like one day we're gonna have to talk to our patients about this, or stuff like that. So how do you like start the conversation?
Yeah, that's a really good question. I think one thing that, and I think this happens a lot for a lot of different mental health topics, is that it's really hard for people to just say what's going on, or to just like explicitly talk about, like, this is what happened to you and this is something that, like, we want to talk about. It's very, like, people are always scared to, like, say the word sexual assault, say the word, like, sexual abuse, because it is like a scary thing that happened to that person. But I also think that not talking about it, and not, like, just being explicit about it, makes them feel shameful as well. Like, they did something wrong, or like they went through something that, like, shouldn't have happened to them, right? And so I think the biggest thing is, like, if you are interacting with the survivor and they are talking about their experiences, to not like to like also like engage in the conversation, and not to be so scared. I think that happens all the time, right? Like, even if you get a client that is like talking about suicide, your first like reaction is to be like, oh, like, scared about it, and like not want to talk about it. But I think that's what they're lacking. Like, they want it to be something that people are more aware about and they can talk more about, and it's not such a taboo topic.
Okay, that's really interesting. So you kind of go slowly with it, and then kind of enter with like just like being empathetic towards that patient or that client.
Yeah, definitely. Okay. I think it's very much like being empathetic. And I think the biggest thing about trauma is that you have to meet where the person is at. So a lot of the times, like, I like, don't push the trauma, don't push them like saying it, like, wait until they feel comfortable talking about it. Because I think when you, like, yeah, pushing it is like not helpful for them. Like, when they feel comfortable to talk about it, they will talk about it. And then I think that's when you do like the work with it.
Okay. We have a question on the chat. Kadri asks, would you be able to expand more on the theme of cultural competency or the background of the healthcare provider impacting second generation women's hesitancy? And were there common situations that popped up in your research that you noticed?
Yeah, actually. So I think this research was like also done in different countries, like in the UK and Australia and things like that, when I was looking at like barriers to why South Asian women like weren't seeking help, and like if they did, like, why weren't they using like mental health services specifically. And I think one of the things was, like, people felt like when they did go to counseling, there were some like assumptions made about like South Asian culture or Asian culture in general, that I think going into being like, okay, this therapist already has made assumptions about me, but like, this isn't specifically my story. So that's why I tell people all the time. Like even if I was working with another South Asian client, like just because they're South Asian doesn't mean like we share the exact same experiences and we have the same story and everything they're saying is going to relate to me. Like everyone is going to have their own individual unique experiences no matter what. And so it's very, very important to come in like listening to what they have to say. And there's probably going to be an overlap. It's probably going to be easier to talk to me because we do have some of the same like ideals or values or whatnot. But at the same time, we might not. And I think integrating into American culture like makes that so much more nuanced and so different for everybody. So I think the most important thing is listening to the person and making sure you're not making any assumptions, you're not making any stereotypes, because I know that's one thing that some South Asian women did report, like they felt like they were making stereotypes or assumptions about them, or that there was also one study that said that Asian American students have like a high adherence to Asian cultural values, but then they tend to have negative like attitudes towards seeking professional help. So like if that's like what the ideal that you're gonna like assume about the person, then like it's also gonna be hard to like get them to buy into therapy, if that makes sense.
And so in just like thinking about therapy and stuff, like what are the common signs or symptoms that you've noticed that, oh, this person might be like a sexual assault survivor, or maybe this person has been sexually abused in the past? Are there things you've noticed when you've talked to them? Are there things that stand out?
Mm-hmm. I think the thing that's tough about that is usually like we get the client already who's like coming to therapy who like wants to talk about those things and not really. I mean, there are definitely clients who will come in who like aren't ready to talk about it. I don't know if there's necessarily any signs or things that you see. I think the biggest thing is that when the person feels comfortable talking about it, I think that is like the only indicator that you can like wait on. I don't necessarily think there are any like sign or symptoms that you can notice, but I think um, making sure that you're waiting for them to disclose their own trauma to you and not pushing them, like I said before, is like the only thing that you can really do in that situation.
And regarding, like you said, therapy was one of the options that these survivors can undergo. What about like any other, like, are there any other resources that they can maybe use to like get better?
Yeah, there's definitely a lot of, and I can maybe send this to y'all to if you guys want to put it out there on your stuff. But
Sure.
there's a lot of resources that like crisis lines for sexual assault survivors. There's a lot of groups. There's a lot of um, groups where like other survivors are in there, which I think is like a great way to kind of seek support because there's other people that have kind of experienced the same thing as you. There are also a lot of support groups for like specifically women of color who have experienced sexual assault or abuse. Yeah, I have like a list of them, so I actually can send them all to you. And yeah, if anyone today is feeling like they want those resources, please reach out to one of them and they will send it over to you.
So those are like the resources that we can use, and like we can like disseminate that. But in terms
Yeah.
of like, if we know someone that's been sexually abused, like
Mhm.
what do we do? Like, let's say they don't want to go to therapy, they don't want to use these resources. So what are the other options? Like, what can we do as just like a like a bystander? We can't really do much besides just tell them about things, you know?
Right, right. And yeah, that's a really tough situation when they don't want to like seek help for it. And I think that's the point of this research too, is like making people more comfortable into going into therapy and not making it this scary place. And as like a bystander or as like a friend or a family member, I think the most important thing is not letting the person feel shameful for what they've experienced, because I think another big thing that I found in the research is like shame is like a big indicator to why people don't disclose their abuse or don't disclose their assault. And if they're feeling shameful, and if like we as a friend or like as a family member make them feel even more shameful, like they're not going to want to talk about it. And I think making sure, like I said before, like if they're being explicit about it and talking about it, like be brave and like talk about it with them. Like I know it's a very, very hard topic to talk about. And even as a friend, like it's probably really hard and sad to hear, but I think being brave for them and showing up for them is just as important too, and listening to what they have to say and being their support system. If they're not willing to go seek professional help, then like you and family members might be like their only support system. So you're just as important.
And I think that kind of goes with like the stereotypical like Desi Indian, like South Asian kind of thing where reputation means a lot to us. So it's like the idea of like what we stand for and who we are, it's like this small thing or whatever it could be, it could affect us negatively. So I understand that, the shame thing.
Yeah, I think
So in terms
like,
of, yeah, go ahead, sorry.
no, go ahead, sorry. No, I was just saying, I think that's the biggest piece that I saw was like, why aren't they like disclosing? And it's because they feel like it's the shame piece. Yeah.
And so in terms of getting a clinical, someone else asked, Kavya asked, validation about, or she said, validation about how the traumatizing experience is, and validating the hesitancy to go to treatment seems huge too. So just understanding that it's traumatizing and how it can affect the person. Mm-hmm.
Right. Exactly.
I was also really curious about how, so currently there's a lot of medical students here, but in terms, what is like a psych D entail? Like this doctor that you're getting, like what is it? How many years does it take? And like how do you get into this? Like all that kind of stuff.
Yeah. So a PsyD is different from a PhD, but they're also the same kind of thing at the same time. So both are doctorate degrees in psychology, but a PsyD is more focused on like the clinical part of it, and like a PhD is more focused on like the research part of it. So we do some research, like this is my research project basically, but most of our so it's a 5-year program, but most of our 4 years or 5 years is just based on clinical work. So we do a lot of working with people in different like areas that you're interested in, but we do less research. So that's the main difference. And PsyDs are 5 years, and sometimes PhDs can be like up to 7 years, depending on when you finish your research. But yeah, I was more interested in the clinical part. And not as much as the research. So that's why I chose the PsyD route.
So like what does your future job entail with this degree in a couple of years?
Good question. So the point of like finishing your PsyD is to be a psychologist, but there's so many different areas that you can go into, and that kind of just depends. So I actually specialize in working with children. So I'm working towards being a pediatric psychologist, so working with kids who also have medical illnesses and coping with medical illnesses. But there are other avenues you can go to, like you can be a psychologist at a college counseling center, you can work at other hospitals, you can work at inpatient units, you can work in the prison system, you can work at a private practice and just like start doing therapy with kind of like the population you choose you want to do therapy with. So there's a lot. I think one thing that I really appreciate about doing a PsyD is there's a lot of avenues you can go to. You can teach, you can do research, like you don't have to do just one thing. Like most of our professors do multiple things, like they supervise other students and then they have their own private practice and they work in a hospital. Like they get to do like what they want to do, so that if anyone is interested in that, that's the cool part about it.
That's amazing. Okay, and then one of my other questions let me pull it up. Do you believe that as the world starts to become more progressive in like the South Asian culture, that we'll have less victims of sexual abuse? Because I know that this topic is always going to remain, but you think that it will eventually get less and less as time proceeds or goes on?
Mm-hmm. I mean, that is the hope. I don't know if the amount of people who get assaulted would decrease, but my hope is that the amount of women who speak out about it and who seek help increases. I think that is something that we could actually try to like be more preventative about and talk more about, because yeah, I'm not sure if like that rate is going to go down of like that at all, but I know that like as we get more progressive and as we talk about this more and more women can actually seek help and maybe like can heal from their trauma. Because right now I think what's happening is like it's such a traumatizing thing, like one of y'all said, and that like it's so invalidating when you don't get the help that you need. And so my hope is that like more people talk about it and that they can like get the help they need and can heal from the trauma.
I think that I remember watching a movie. I forgot the movie name, but like in Bollywood, especially, like they're slowly
Mhm.
putting the idea of sexual assault into these movies so that it
Oh
raises
my God,
awareness,
yes.
which is
Yeah.
a really good tactic to use because like although like newspapers and everything is like, or even internet is a really good source or resource, putting it into
Hmm.
movies though makes a different kind of feeling and empathy. And in terms of that movie with it was Deepika Padukone with like the woman in like, the act. I don't know if you watched it.
Yeah. Hmm. I didn't watch it,
Um,
but I know what you're talking about.
like so I think that raised a lot of awareness just for like survivors in that sense. So I think like Bollywood's doing a good job with what are other things that you've noticed that like South Asian like communities are doing to help like bring about this and like, bring it into light.
Yeah, no, you brought a really good point about I feel like for like in India especially, like movies are such a huge thing, and so not like in other areas like Tollywood and other types of like movies have also like started putting more awareness about sexual assault and having movies about that like I think has been a really good awareness point. I think also I think there have been cases that like rape victims and things like that have been happening. I'm specifically going to talk about India because I feel like I know more about India, but there have been more like social media awareness about it. More people have been speaking up, being like, these people need, like justice needs to be served, or like this wasn't okay. And like more people are talking about it. There are more documentaries on like things like this that have happened. And I think that already is like really good awareness to show that, okay, like people do support these women and there is like some light out there. So like I think that shows that like there is some momentum going in this department, and hopefully it gets just better and better and more women feel more supported.
That's me. Yeah, that's really good. Pooja, do you want to add anything?
Yeah, I actually had another question that I was kind of thinking of, but I feel like a lot of South Asians, like their general idea that they have of sexual assault is, and like maybe it's because of movies or like news coverage or whatever, but they kind of think of the perpetrator as like being a stranger. So I'm wondering if you
Hmm.
had any instances or like any, even like what you found in your literature review or anything of like intimate dating violence or like partner violence, that kind of stuff.
Yeah, so that's a really good question. I feel like unfortunately I found a lot of research on like most times the perpetrator is someone you know. And it's usually a lot of the research that's out there right now is about intimate partner violence. It's usually the husband or the partner or it's someone in the family. And I think that actually makes it 10 times harder for women to talk about it because it's someone in their family, and for the family, it's like, okay, we're going to cover this up because we don't want this to get out about our family. So that was a lot of the research that I saw too, that when that's happening in your family, like who do you go to? Because if I go to some other person now, they're going to know this whole thing about my family and that makes my family look bad. And like that, it's just like a cycle that's never ending, right? Um, so unfortunately, yeah, like that, it's usually someone you know, and it's usually like in your family.
Yeah, I feel like along with that, it's not always the fact that they have been assaulted that the family wants to cover up, but sometimes it's like the stuff that comes before it. So like maybe that the woman like drank or like went on the date in the first place or like whatever.
Hmm.
It's more like
Hmm.
blaming kind of ideas.
Right, right. I think that comes back to like the like whole like the whole thing of like, oh, like the woman asked for it, right? Or like what did they do before, and like why did this happen, versus like we need to be focusing on like what happened and not what happened like before, because no matter what, that was not okay. And so I think it's just like unfortunate in the way that like it still goes back to like the patriarchal society and how women are portrayed, and why some of those things need to be like talked about more and shown, and like helping women like get the resources they need, because I feel like a lot of these things like are just like they exist, and it's like how are we supposed to put them down right now, right? It's like systems in place that have been perpetuated for generations and generations. I think we're trying, I think we're getting better at it, but I think it's still there, and so the hope is that like I think I've said this 10 times, but the hope is that we can find them like help and like seek this help for the systems that have failed them.
So I'm just curious, and do you have any knowledge about like Indian laws in terms of sexual assault? Like what if someone's a victim, like, and you find the perpetrator and stuff like that, what happens? Are there rules? Are there laws? Is there jail? Is there death penalty? Like, what is it?
Mhm. I don't really know what the laws are in India, but that's a good question.
Recently in Pakistan, because I'm Pakistani, so recently there was this case. This woman was visiting from France. I think it was in Karachi, which is like one of the biggest cities in Pakistan, and she got sexually assaulted there. Like, she was
Mhm.
driving and it was like late, and I guess like she ran out of gas in her car, so her car stopped. She ended up getting sexually assaulted and stuff. All that happened. Eventually, found the guy who did it and stuff. But I think in Pakistan, like, they're slowly moving towards like a death penalty. So he
Mm,
actually got hung because of that
wow.
act. So yeah, so I was just curious to see like what kind of rules are there in India. I'm not really like
Yeah,
not familiar. Yeah.
I'm not really sure either. And I think like another thing about like the perpetrator is also like, and maybe I like come from like the mental health perspective too, is like a lot of the times the perpetrators are also people who have experienced their own trauma and their own abuse, right? So it's like so many like, and a lot of the time it's like intergenerational. So it's like just like continues to happen in the family. And so even they need help. Like the hope is that both sets of people like get their own help and like can, because like usually like I said, the perpetrator has experienced their own trauma or abuse, which
Are
is
there
sad.
are there like laws in place in the United States? Like, what happens here if someone like goes to the police? Like, what happens? Do you have any knowledge about that?
So it's typically like they try to find the perpetrator, and then if it's like, sometimes there's trials, sometimes whatever, but like if they were found guilty, then it is jail
There's jail. Okay,
time.
so it's
Yeah,
not death penalty, correct? Here.
I think no, but I also think there's different state laws, so I'm not really sure.
Got it. Got it. Okay. Okay. Cool.
Mm-hmm. Mm-hmm.
I'm just curious.
I was also wondering if there is any, like, I don't know if you found any research on this or if you were even looking into it, but what were the differences that you saw between, I guess, like first generation or like people living in India or in South Asia versus
Mm-hmm.
second generation that you did your, like, focused your research on?
Yeah, I didn't find like too much about like people who live in India and like the immigrant population there, because mostly focusing on like individuals that live in the US and like live in America. But I know like the number, like mental health rates overall, and the numbers on and like statistics on mental health are just like very underreported. Like they don't have a good sense of what the rate and statistics are, and neither do we here also. And maybe we have like a better gauge of it, but it's also just a lot of underreporting. So and I think that goes for just like Asian Americans and Asian people in general. It's just like very underreported. So it's really hard to find like real data and information on that.
That's interesting.
Mm-hmm.
So I don't have any more questions. I don't see anyone in the chat. Actually, there is someone who just said something. Kadri said, after reading so much about the topic, any areas specifically that you saw was lacking research for South Asian women and sexual assault, and what kind of studies would you like to see in the future?
Yeah, I think the biggest thing. So I think one thing I didn't mention in the beginning was the biggest hope of this is that we can create culturally relevant interventions for South Asian women when they come to professionals and are seeking the help, right? And I think we don't have a lot of research on what are some culturally relevant interventions we can use for this population. And so that I think that's like lacking research. I think we're lacking research overall for South Asian women and mental health. Like intersectionality is like the biggest thing that we lack research in. Like a lot of our research is like done on one group of people, but like it fails to consider all the intersections. So like being a second generation South Asian, you're just not going to really find research like that. So those are more of the studies I want to see, is like about intersectionality, and because that's such a huge piece. Like you don't just have one identity, you're multiple things, so I'm hoping like there are more research projects like this that can come out and can, assess all of these issues that people are experiencing.
I guess considering that there's so little research, I don't expect any of this, but I was wondering if you did see anything about like LGBTQ populations, or like any kind of immigrant, even if it's not South Asian.
That's actually a really good question, because I think in my study too, I wanted to include the LGBTQ population in it, but because it's already like so many variables and layers to it, I couldn't. But that was one other area that I felt like very underrepresented, not talked about, and especially like South Asian, like in that community, like I feel like it is very low. And so I didn't see much, I will say, but I feel like what gives me hope is that there are more like clinicians of color who are doing more research on like different areas that they feel like their communities are lacking research in. So like that gives me hope that like we are getting there, and we'll get to a point where not just clinicians of color, other people can look at other areas that are like that need the research, you know?
Okay, I'm just gonna open it up to the floor now. If you have any questions from like our audience, but we really appreciate you being here, Thanusha. We learned so much within the short amount of time we had. But
Yeah, thank you so much.
I was wondering if you're okay with it. I was going to ask for your contact information, so if anyone has any questions, they can just email you directly. Is that okay?
Yeah, of course.
Okay, and then we're also going to figure out a way to post your resources that you mentioned.
Yeah.
And that will be a good resource. That will be good for us to post and people can learn. But actually, one more last question. Sorry if I missed this earlier. I know research isn't your primary interest, but are you hoping to construct research studies to develop and test culturally sensitive therapies for trauma while you're in your program?
Yeah, I really research isn't my like primary thing, and I really wish that I could do that. That is like honestly something that's very much needed in the research field. But as like someone who's practicing therapy and trying to be as culturally aware as I can, like I'm trying to, like we all try to use like as like culturally sensitive therapies like throughout. I'm not doing research on it, but the hope is that clinicians all across the board are trying to integrate that, and it's not just like something that they read about or like they have a presentation on diversity about. It's like actually integrated into their work.
I think that's hard because just like, how can you teach like a doctor who isn't in this culture and a different one to be like, yes, like understand this person, like you have to like in a class, you know, it's like hard to understand that. Because even in our school, we're trying to figure out like a class or something that teaches like future physicians on how to like teach cultural competency. But like, you know, it's so hard. Like it's not something you teach, you kind of learn it as you go on. But I'm sure that in the future there will be things that will teach physicians and doctors and everyone in the healthcare field to be more culturally competent, I guess. But yeah, I think it's slowly gonna get there eventually. But yeah.
I honestly say the biggest thing is like try to come in like you're always gonna have biases, and you're always gonna like bring that into the room. But I think the biggest thing is trying not to make any assumptions about the person, and like being curious and asking questions that are helpful to the person. And you're not like, oh, I already know how you're gonna be, you know, because that's like the bias that comes into the room. Like listen to what the client has to say. That's the most important thing.
And I also think it's really easy to like stereotype a person because, you know, like we do our patient encounters with like practice, and usually one of our professors will watch side of like the room. And I remember like I was doing an encounter and I said something really like, it was really like very, very small. It wasn't like, I was like, oh, that was, the history wasn't too bad, or that's a lot of problems, something like that. And the professor after, he was like, you can't say that. Like it was so in our like normal, like, oh, that's not bad. Like it's just a small thing, but he was no, like, you can't say that patient. So you never know who you're talking to or like what they're thinking inside. So I think it's really important to just be more attentive towards what we say to our patients.
Yeah. And like if someone like corrects you or says something like, no, that's not my experience, like try not to be defensive about it, being like, okay, like I'm gonna take that and learn that for next time.
Yeah, absolutely. Thank you so much for coming. I'm gonna, what I just said, I'm gonna post all the stuff with the resources. We really appreciate your time, and we wish you the best in your study.